we're going to jump in and start talking a little bit about some brain health and depression, anxiety, things of that nature. Part one of two. There's a ton of information. We could talk about this for 12 days. And to be honest, we've started to talk about it in pieces before with some of our other talks. If you've missed them, whether it be the EMF one or the stress one, even some of the coronavirus ones that we did early on, we started to discuss some of the brain health and depression pieces. And so if you missed any of those, get on YouTube. I think I have them all uploaded at this point. I think there might be one or two that are not. I'll have to triple check my records, but most of them are up there. And so if you missed them, get on, watch them, share them, whatever you want to do. But we're going to jump into brain health. So Dr. Mike, why don't you run with it to start here?
Well, I want to agree with what you were saying. I think it's so appropriate for us to be continuing down this line of everything of talking about the sympathetic nervous system, flattening the fear, dealing with all these things that everybody has to deal with, and to be able to talk a lot, I would say, on depression is huge, because it's such a ubiquitous topic, as well as overlying so many different things. I mean, I will say this is that in my world, in the allopathic world, family medicine, we talk about the 10 most common diagnoses in family practice, and of the 10, like hypertension, diabetes, guess what's in the top 5? Depression. And we're not just talking about depression from a standpoint of, geez, I'm sad all the time. That's a different entity altogether. So we're really talking about, brain depression. So think about that. Your brain is depressed. Okay. Your brain is not doing what it needs to be doing. Why is my brain not working, etc.? Why am I feeling fatigued? Why am I feeling depressed? Why do I have this continual depressed mood? Some of the things that go along with that are I'll give you just an idea from our textbook is, you've got a sort of a chronic depressed mood, anhedonia, which means you don't like to do the things that you normally love to do. Okay. Oh, you're a shopaholic. Well, guess what? You're not shopping. What? Wait a second. I'm not spending money. Well, never mind. I won't say anything about that. Insomnia, hypersomnia, sleeping too much, just not sleeping enough, change in appetite or change in weight. That's all part of it. Psychomotor retardation or agitation. In other words, getting too agitated or just feeling totally not having any energy to do anything physically, okay? Which is a big part of one of the big treatments that we'll talk about too. Of course, low energy, poor concentration, and then it kind of actually builds up into some of the things that you always hear about when you go to the emergency room anymore, and the first couple of questions they ask you is, do you feel safe and do you feel like hurting yourself? Okay, so these are all sort of depression screens that are out there these days, and they all kind of play into so those symptoms, and the symptoms tend to go a little bit with some of the deficiencies or the neurotransmitters, which I think Dr. Kevin's going to talk a little bit more about inside. So the thing about this is that there's so many comorbidities or so many other things that go along with this at the same time. So it's not just as simple as talking about neurotransmitters. And as with anything, we have an evolving level of knowledge of everything. I mean, we do not understand the brain as much as we think we do. And there's so much more that we're going to learn about it, etc. So it's not just as simple as a deficiency of this, diabetes. Oh yeah, it's a deficiency of insulin and now your blood sugars are high. Well, that's pretty easy to some degree. I mean, there's a lot of other comorbidities with that too, but this is a different entity because we're dealing with brain, we're dealing with nerve functions, etc. So don't forget things like chronic pain. You've got anxiety and panic disorder syndromes that go with this. Heart disease is a big part of depression as well. Medications. I mean, one of the things that we always talk about at Restorative Wellness is the less medicine, the better. Okay. Now, there's obviously ways that we can supplement different things, but big pharma out there wants to push all kinds of drugs all the times for everything. And the more drugs you get. So you end up with this polypharmacy issue, which is depressing in and of itself. There's neurologic disorders, there's endocrine disorders, diabetes. I go back to diabetes and the overlay with that. Thyroid conditions are notorious for having an overlay with depression as well, not to mention the autoimmune deficiencies and things like that too. So just, we're dealing with a topic that is again ubiquitous across so many things. Some of the collagen vascular diseases like lupus have actually part of their diagnostic part of you have to have 4 or 13, and one of those is depression. So we're talking about something that is all over the place. Treatments we're going to get into. Kevin's going to talk a little bit about, I guess, the neurotransmitters, etc. Obviously, people know that in the allopathic world, we've got medications out there. Everybody knows about the SSRIs, the Prozacs, and the Lexapros and the Celexas, and they all have their spots for different things. There's SRNIs. There's tricyclic antidepressants. There's MAOIs. I mean, you name the alphabet soup, and we can probably kind of bring up something for one of those things. Yes, there are places for each one of those, but that by itself is not the answer. There's many studies out there that actually show, get ready for this, that aerobic exercise is more effective than taking a pill of Lexapro every day. So let's start getting back to some of the basics we even talked about multiple times with regards to COVID. Get out there, do some aerobic exercise. Wash your hands, personal hygiene, drink your water, all those other kinds of things. They play into your overall well-being, wellness, I'll use the term. And what we're talking about even here is as it relates to brain health in general. So don't forget about those types of things. Sleep, making sure you do that kind of stuff. So there's a bunch of neurotransmitters that we're going to talk about, what they call the monoamines, which are the dopamine and norepinephrine and serotonin, and that's a big part of it. There's inhibitory ones called GABA, and then there's glutamate. There's a bunch of different neurotransmitters, and we'll get to that. And that's important as time goes on because it's such a big piece of functional medicine and what types of things we can do other than medication that makes sense and is going to be much more effective for a lot of people. Hey, we've all seen these commercials recently. Now if everybody, hopefully they're not watching the news like we've advised them to do, so they can flatten the fear because that's so anxiety provoking. But there's a commercial out there for something called Rexulti, Rexulti. You probably have seen it. It says, "Oh yeah, my doctor prescribed an SSRI and I was doing better, but I'm not all the way better, so I got to take Rexulti." Well, geez, what does that tell you? That tells you that it's not just as simple as one type of deficiency. So let's take another pill to make the other pill work better on top of everything. So initially, when we talked about allopathic medicine, we talked a lot about depression being a result of a deficiency of serotonin. That was the big thing for the longest time. And that made it easy because then we could label it and then we could diagnose it and we could treat it specifically with that one pill. But we all know that worked for a lot of people. Don't get me wrong, that certainly has helped a lot of people kind of get back into a normal groove of life, etc. And I'm not saying that all medicines are bad. Obviously, this is my background, etc. But again, we need to treat the patient, not just some of these things. So we're actually going to individualize therapy. We're going to make sure that this is not a protocol. This is not a cookie cutter type of a thing. We're going to make sure that we talk about what's right for you as an individual. So we're not talking about just, oh, you've got depression. Oh, that means you've got serotonin deficiency. Oh, that means you need to be on an SSRI. And here's a prescription for 10 milligrams of Lexapro. And call me back in about 2 or 3 months and let me know how it's working, because it takes about 2 or 3 weeks for it to even do anything for you. Well, you know what? That's BS. Okay. We also know now that there's such a big part of nutritional factors with all this, and also brain inflammation has become a big thing. And I know Kevin's going to talk a lot more about that kind of stuff too. So we've talked a lot in the past about gut health and how the gut biome plays into the brain and back and forth. The gut's probably the secondary brain inside the body. So let's talk a little bit about that, how that plays into things, and how nutrition plays into that, and such a huge role with all that kind of stuff. Because as somebody said recently, and I really kind of got struck by that, is that we are overfed but nutritionally poor. Okay, and so we got to start looking at that kind of thing, and maybe that's some of the stuff that's behind. The brain inflammation pathways, the cytokines, and we've talked about cytokines multiple times, Kevin, right? We've talked about cytokines and how they have an effect. You know, we know more about it because of COVID recently, et cetera. But brain inflammation and the cytokine pathways with regards to the brain cascade is a huge part too. So that kind of, I hope that lays a sort of a big, broad kind of landscape for people. And I'll let you guys kind of fill in a little bit more with regards to how that kind of goes from point A, this generality, to some more specifics.
Yeah, no, I think, you point out a couple of great pieces, obviously, and that is the fact that lifestyle matters, not just, Doc, I feel, kind of sad, and well, here's a pill, go have fun and keep doing whatever you feel like. The reality is there are so many things that we can be doing, and Ash will talk a lot more about that, and she'll probably talk a lot about the nutrition pieces to an extent. We'll both dabble in that here, but last statistics that I saw, and that was, I know they're a couple of years old at this point, actually, but I think the last number I saw was that 19% of the American population has been diagnosed with clinical depression. So roughly 1 in 5, okay? Which is crazy when you stop and think about it. When you talk about a chronic illness or a chronic disease, this one's up there, and it is, as you said, Dr. Mike, so ubiquitous. It is widespread. We all know people who are depressed. Some of us might be ourselves. Some of us are on medication. Some of us aren't. But, depression is a real thing, and anxiety gets coupled in with that a lot of times. They get confused oftentimes. And as I said at the beginning, this talk is going to be like our 50,000-foot view, part 1. We're going to go in a couple, 2-3 weeks here. We're going to go into part 2, and we're going to get a lot more in the weeds with perhaps some science on some of the deeper layers of neuroinflammation and things of that nature. It'll be really fun. I'm excited for that. But when it comes to where we're at today, we want to keep at that high level so we all understand some things. And Dr. Mike mentioned neurotransmitters, and neurotransmitters are the chemicals in our brain that make us feel and function in certain ways. And we know now in science that a lot of neurotransmitters are actually made in our gut, are impacted directly by our microbiome. And so gut health matters. The health of all of the microbes, the constitution of bacteria, viruses, yeast, fungi, parasites, on, it all matters. You are what you eat. You are what's living in you. We've got 10 times the amount of bacterial and other cells in and on us than we do human cells. And so, you're a lot more bug than you are person. So to break the news to everybody, a strange concept for many to think of for the first time, but that's the reality. And when it comes to the production of neurotransmitters, as I said, a lot happens in the gut. It happens in other spots in the body too. But when Dr. Mike mentioned SSRIs, the reality is that's so frequently the first line of action that most people go to when it comes to intervention for depression. I mean, I don't know if you can even speak to this, Dr. Mike, but like even in just your experience, colleagues and other people or practices that you've been at, et cetera. I mean, people come in, how frequent is that? Just, well, let's try Lexapro, and they just hand it over without looking in depth at some of these other pieces.
One of the reasons why I'm doing what I'm doing now is because of the disgust of what it was before, where, you know, you were given 10 minutes to see a patient, to diagnose what's going on. And think about this. I mean, most people come to the doctor, they pay their copay, they pay whatever they have to pay, and they want to take something away from it. So bottom line is that people will come in, they say, I'm depressed, or I'm feeling very anxious, or I'm feeling no energy. Oh, well, you know, no energy. Oh yeah, you've got depression. Here, take this pill. Boom. Okay, that's you know, a 7-minute visit. Okay, that's great. You know, and I can document that. I can bill that. I can bill that to the insurance company, and you know, you can't really say anything because it's going to take 2 to 3 weeks to be effective. And you know, oh, and by the way, yeah, maybe I'll send you to get some psychotherapy too, so you can go do some behavioral things. And oh, you know, and that's that. And so yeah, I mean, it's the easier way to treat somebody in a 10-minute time frame. And to give them something, and hey, I've got a reward. I've got a prescription. This is going to work for me, and I'm going to take this. And then, you know, you get disillusioned after a while when it doesn't work for you, because you're not eating properly, because you're not exercising, because you're not doing the things that we should be doing to maintain health and wellness, rather than just taking a pill and getting better.
Yeah. Yeah. So, you know, would you say that the class of SSRIs is probably one of the most commonly prescribed groups of medications, though?
There's no doubt. I mean, they tend to have the least amount of side effects. They're the newest class. Well, I shouldn't say that. There's SRNIs and that kind of thing too. You know, you hear about all the messes that Prozac. When Prozac came out, there was nothing else available for a very long time, and nothing was really helping much. Prozac all of a sudden gave people energy, was very stimulating, or I should say activating, and people did great. But it also, as you probably know, also stimulated a lot of people to the point of suicide, because they acted out on their depressive thoughts and ideations. And that goes to show you that it really wasn't treating the underlying problem. It was just kind of giving them energy to get out and do things, so they didn't feel so lethargic anymore. So it was a misdiagnosis to start off with. Yes, SSRIs, Prozac, Zoloft, Lexapro, Celexa, just name a few, are by far and away the most highly prescribed medications in that group.
And the function of those SSRIs is essentially to keep more serotonin hanging around in the brain,
yeah,
be able to be doing its job, right?
Yeah,
and so one of the,
as you're going to say, and I'm sorry to interrupt you, but SSRI, as people who don't know, is a selective serotonin reuptake inhibitor. So we'll talk a little bit more about that, neurotransmitters, and what the presynaptic and the postsynaptic and the synaptic cleft and all that. We'll talk about that, but that's what, yeah, I'm sorry. Yes. Mm-hmm.
Yeah. And so, you know, one of the things that I think always, I'll say, upsets me when I meet with patients, and, you know, if anybody's on the call who's been with me with functional medicine or whatever, I draw this one out. I draw out different neurotransmitter production pathways in literally 30 to 60 seconds with people, and help them understand, how are these things even being made? What's necessary? You know, I always tell people, you have to have the raw ingredients to bake the cake. You know, you don't have the eggs, the flour, and everything else, you're not going to be able to, you know, produce what it is that you want. And unfortunately, most medical doctors, psychiatrists, etc., don't even perhaps remember this, and certainly don't really share it with their patients of, here's what is going on physiologically in your body. Why don't we make sure that all of these pieces are there before we go ahead and hand the pill over? It's not saying there's never a time and place. However, once again, are the raw ingredients there? So I did this, I think, with the thyroid. I did something else. So I drew again. You guys love my drawing. You're gonna love my drawing. I know it's backwards for you, but it showed up okay on YouTube when I looked at the last one. So I don't know what the deal is, but serotonin. All right, here's how we make it. Everybody should understand this. It's simple in a lot of ways. You start off with protein. You have to eat protein. And I highlighted a few other things in the other color here, and we'll talk about that. But you have to eat protein. Protein gets broken down into amino acids. The main amino acid that we care about right now is tryptophan, okay? And so tryptophan hops onto a full transport molecule called LNAA, which transports tryptophan across the blood-brain barrier. Tryptophan is now in your brain. Tryptophan gets turned into something called 5-HTP, which can be a common supplement that different functional medicine doctors might utilize to help somebody with depression. But then that 5-HTP gets turned into serotonin. Serotonin then becomes melatonin. So now everybody understands why when they eat their turkey on Thanksgiving, they might get tired because they're perhaps upregulating production of melatonin as well. Now here's the big deal. This is the part that matters. Are you eating protein? Yes or no? Pretty simple. And when I say protein, I'm going to be talking mostly about animal proteins here. I'm not sure what the tryptophan content is in plant products. I'm honestly not even sure if there is any. That's my bad. I should have looked that up before I started mentioning that. But I don't think it's high or significant if it is even found in most plant products, okay? But animal protein is key on this. Whenever you eat, though, you have a number of things that are critically important to happen. You have to be consuming it, obviously. You have to be digesting it. Your body has to be able to break that down. And most people don't realize that with protein digestion and utilization in the body, you also have to have proper blood sugar handling. This isn't just carbohydrates for blood sugar handling. Food intake as a whole is critical upon proper blood sugar regulation. You have to be absorbing those nutrients. Once again, gut integrity, gut health matters. I can eat all I want. If my gut lining is unhealthy and I can't absorb anything, or at my transit time, things are just flowing through me, you're not getting the value out of your nutrients that you want. Once you get the tryptophan into your brain, to turn into 5-HTP, it is super iron dependent. That's what the Fe is, for those of you who don't remember your chemistry from 10th grade. All right. But tryptophan, if you're anemic, you cannot turn it into 5-HTP. It is iron dependent. Okay. And then 5-HTP gets turned into serotonin, and that's dependent on B3, 6, 9, 12, magnesium. Okay. Once again, if you don't have those, you can't get to that step. So, you know, if you're diabetic, if you've got a leaky gut, if you are vegan or vegetarian, if you are anemic, if you're anemic over here, if you've got other B vitamin deficiencies, magnesium deficiencies, as we talked about on the EMF talk a couple weeks ago, most people are magnesium deficient. The pathway is going to get stonewalled. You're not going to be able to progress through that cycle to make this. And then serotonin turning to melatonin. I mean, how many people have sleep issues? If you want to understand sleep a little bit, go read Matthew Walker's book called Why We Sleep, probably the best book out there on sleep and why it's important. But serotonin gets turned into melatonin through a process called methylation. Methylation is a process that happens billions of times a second in the body. You can kind of think of it as your body's detox mechanisms, as your body's cellular repair, sort of going around looking at the cells in your body, tagging any damaged tissues with a work order so that your body can come in and say, do I need to repair that cell? Do I need to destroy that cell? What needs to happen? And so
it might be worth mentioning that roughly 40 to 50% of the population has genetic polymorphisms, SNPs, and THFR gene. So if there is an inhibition in that gene expression, then those things that Kevin mentioned are not going to be happening as efficiently or at a very decreased rate.
Yeah. And so at the end of the day, you know, as I highlight that pathway, I mean, we can draw that out for dopamine. We can draw out pathways like that for epinephrine and norepinephrine and acetylcholine and GABA and all of these other neurotransmitters that are critical for brain function. But, you know, your doctor should be able to talk through some of those basic pathways and at least know that on their blood work that they're ordering for you, you have enough magnesium, not just, you know, serum magnesium, but red blood cell magnesium. Let's look at the storage tank, looking at your iron profile and include a ferritin. Make sure that there's enough in the storage tank, making sure that your magnesium, all of your B vitamins and where are they at, and understanding, you know, hey, B12, if I test it in the serum, that may or may not be the most accurate way of looking at it. There's another marker, the methylmalonic acid, that's going to be a perhaps better indicator of a B12 deficiency. And, you know, having the ability to talk through these pathways and make sure that you as a patient, or that your child, your spouse, your family member or friend has a good working knowledge that they have everything that they need to produce that. And if they're still depressed, then fine, let's look at what else might be driving that. But we at least know that some of the key factors and ingredients are present in order to make what the body needs to function properly in the brain. So maybe we'll go through dopamine and something else on our next talk. But, you know, I think we need to understand that these chemicals are critically important, but they don't just magically appear. Our body has to make them, and there's a lot that goes into forming those things.
And there's such a thing as essential amino acids, like you talked about with amino acids, which basically means that these are things that you have to get from your diet your body can't make. Yeah. So I think that's where Ashley can certainly help us out with for all the different health issues as well, but also just as we're talking with this specific topic. And I would hope that your doctor, if they're going to be doing blood work, to do these things to check and see what your levels are as the base, okay, as these base compounds are that are going to help to produce it, but also be doing the blood work to exclude other entities, like I talked about, to exclude thyroid disease, to exclude diabetes, to exclude some of the other things that could be causing the depression as more of a symptom of the underlying condition rather than otherwise. And like I said, unfortunately, that doesn't happen very often. It's a lot easier just to prescribe a pill than actually think through it, write up a lab slip, have the person go out, get the blood work, have the blood work come back, have to call the patient back, tell them the results. So let's treat people rather than just numbers.
Yeah, and I wanted to look up, so when you mentioned essential amino acids, tryptophan is an essential amino acid. I was looking up a food list real quick because it bothered me that I didn't know the plant thing, and it is found in plants, okay, but it's most plentiful in dairy, meat, eggs, fish, things of that nature, but it is found. It is in chocolate, everybody, so everybody can be happy. It is in chocolate, but some of the seeds like sunflower, pumpkin seeds, chickpeas, almonds, buckwheat, spirulina. So it is found in some plant products as well, but your animal products are still going to be the highest concentrations. But when we say essential amino acids, your body cannot make this. Animals cannot make it themselves, okay? So you have to get it from other sources. So Ash, fill me in.
Some things that we need to keep in mind when discussing depression is the inflammatory cytokine model of depression, which has been theorized since the 90s. So sort of new in this landscape of research, but it really involves cytokines, which are signaling molecules that are produced by the immune system. And there's various families of cytokines, the interferons, the interleukins, and growth factors. Perhaps you've heard us talk about interleukin-6, which is a pro-inflammatory cytokine within the body. There's many pro-inflammatory cytokines and anti-inflammatory cytokines, but we're talking in this case about the pro-inflammatory cytokine model of depression because I should say anxiety and depression because
that's how you often see it in the research.
But really what it's telling us is there's increased levels of these pro-inflammatory cytokines in patients with depression and anxiety and various neuroinflammation disorders. So the idea is that inflammation is at the root cause of depression, anxiety, and there can be many other brain-based symptoms, but for tonight we're going to mostly focus on depression and anxiety. So keep that in mind. Inflammation, I mean, isn't that like the root cause of everything? But it's important to understand that there is research and there's some exciting stuff about there in the literature. So neuroinflammation is how I'm going to refer to this, neuroinflammation. And like I said, it can have many symptoms, but when we're talking about how to reverse things like anxiety and depression, we need to deal with neuroinflammation. So brain inflammation. So there's different levels of neuroinflammation. So the bottom two would be transient. So you might have, symptoms for a couple days and they're transient. They are, kind of quickly resolve, and that's that. And then we have chronic, which would be ongoing symptoms. You might get some relief, but then you're going to, go back into those symptoms and it's ongoing. Now, both with transient and chronic neuroinflammation, you want to consider what is at the root, what's causing that. There's usually a trigger or multiple triggers causing that inflammatory response. And then we take it a step further. So microglia are a type of cell in the brain, and these cells can become primed. Usually there's some catastrophic event like a traumatic brain injury or a stroke or concussion. But, this is where the symptoms do not improve. Or you might get a little bit of relief, but they're just, your microglia are primed. So,
and what that means is like once these cells in your brain change and go into what's called this primed state, they never go back. That never changes, and so that's a really big deal. And we'll probably delve more into that in part 2 as well. But primed microglia, a lot of doctors are not talking about that yet. This is some of the most newest cutting edge research out there right now. And some of the other more advanced testing that we do is starting to look into and can start to give an idea if something like that is going on, but also a very specific and targeted neurological exam can start to kind of illuminate if that is an issue as well.
Yeah, but we would be remiss to not at least touch on that this is a thing, prime microglia, when we're talking about neuroinflammation. And then lastly, there's neurological autoimmunity. So just as you can have autoimmunity against your thyroid or against the islet cells in your pancreas, you can have autoimmunity against various structures in the brain or cells or receptor sites in the brain. So again, various, triggering events can happen with these autoimmune cases. And a good example for this would be, those who have an autoimmunity against aquaporin 4 receptors in the brain. That, it might translate in various symptoms, but what we need to discuss here is, we're going to talk about diet here in just a second. And, there's an autoimmune response to the aquaporin 4 receptors when these patients eat things like spinach and tomatoes and corn, which, typically aren't our big red flag, inflammatory foods, but, just the understanding that neurological autoimmunity can be very much triggered by diet or stress or, various lifestyle or environmental toxic exposure or other environmental factors there. So again, neurological autoimmunity, and that's going to look very different from patient to patient, whether or not that's going to be like a really chronic or what that is, how that's going to play out. So,
and I'll throw in here as well. There are lots of tests out there. If you're like, how do you know if somebody has autoimmunity against their brain?
Yeah.
There's 2 tests that exist out there. One is through Vibrant Wellness called the Neuroinflammation Plus. We do that at the office all the time. There's also Cyrex Labs, which is another phenomenal lab. We've got a few different arrays that look at neuroinflammation and neuroautoimmunity. Vibrant honestly does tend to be a bit more cost effective for patients, and so that tends to be the one we utilize, but both great tests and with great research supporting their validity and accuracy for diagnosing and being able to give you an idea if you have autoimmunity against various receptors and tissues making up your brain.
Absolutely. It's kind of amazing what you find when you start running those tests.
Yeah.
It's a lot more common than you realize. But all that to say, there are various lifestyle factors that are going to help, promote this pro-inflammatory state within the body. So stress, we talked about stress quite a bit. I feel like we touch on it almost every time we're on here talking, but stress is pro-inflammatory. There's no way around it. Another thing is hypoxia, which is a low oxygen state within the body. We talked about neurological autoimmunity, but just autoimmunity in general is inflammatory. We talk about intestinal permeability or leaky gut. Again, an inflammatory response when, food proteins and various things are getting into the bloodstream. Inflammation, leaky blood-brain barrier. We need to really be cognizant that it's not just intestinal hyperpermeability, but the blood-brain barrier can become there's a lot of barriers in the body that can become leaky, even, pulmonary tissue. So we need to consider all of our barriers, but intestinal permeability and blood-brain barrier, especially as we're talking about neuroinflammation, we need to be, looking at, is that barrier even intact? What does the microbiome look like? So do we have integrity in the cells, and what does the microbiome look like? Is there dysbiosis, more prolific pathogens that rather than good bacteria? Again, pathogens and dysbiosis in the gut are going to cause inflammation. Blood sugar is high blood sugar is going to cause an inflammatory state within the body. Do we have an infection? Is Lyme disease a factor to the inflammation in your body? Do you have EBV, Epstein-Barr virus? There's lots of infections that we can have and not really know that we even have them, or know that the impact that they're having on neuroinflammation.
One thing that could clue you off on this too, if you've ever had a brain MRI, or you once again, a spouse, family member, child, etc., has had a brain MRI, and it says essentially normal, but some little, white matter lesions there, probably indicative of, some inflammation or age-related changes, or perhaps due to Lyme. And the reality is when the radiologist, I've listened to probably some of the world's leading functional medicine doctors talk about this, who have gone and spoken to the leading neuroradiologists on these things of like, why do you guys put that it's normal? And they're like, we don't know. We're not able to do anything else with it, so we just mark it as normal. But white matter lesions being mentioned on MRI is never normal. Okay, that's inflammation, period. It's never normal. And so don't accept that as I don't know, the radiologist didn't think it was a big deal, so my medical doctor said that it's not a big deal. And whether that was your neurologist or primary care or whoever it might have been, it's not okay. Yeah. Is it Lyme? Is it glial priming that we just talked about? Is there some other infection that has been impacting the brain, or what else is creating that inflammatory response within the brain that you're literally, it's able to be imaged. It's big enough and significant enough that it's showing up on an MRI. So don't take that as normal.
Mm-hmm.
Yeah, let me just chime in. I totally agree. I think we talked about this in one of the previous things too. So, when you get a report, and you should sit down and you should always review those reports with your doctor. Don't just look at the conclusion, because the conclusion has this one thing at the bottom. So our technology has now, to some degree, advanced beyond our understanding. And just like Dr. Kevin was talking about, there's something we call UBOs. Okay, everybody knows what a UFO is, right? So an UBO is basically an unidentified brain object, which basically means that it's something that's not supposed to be there, or we don't know what it's doing, and they just kind of pass it off as a normal variant, so to speak. And that may not be the truth. Like Kevin said, this could be scar tissue from a previous concussion. This could be a neurofibrillary tangle from early Alzheimer's type changes. This could be something else that like we're talking about with these primed microcells. So I just, again, you always want to look at the context of these type of imaging studies, etc., and put them in the context of you and your symptoms and the patient, etc. And some of the things that from a real world perspective, I think maybe just as an example, I always like to use analogies to help people understand different things. And maybe if I'm wrong about this, let me know. But everybody who has had migraines knows that there are certain foods and certain compounds that can trigger migraines. So there is definitely a nutrition, nutrient type of association with neurological symptoms. That's the easiest one to remember. You eat too many foods that have tyramine in it, and boom, you're going to trigger a migraine. You don't have your daily coffee in the morning, and guess what? You're going to have a headache. Some of that's just blood vessel type thing rather than necessarily inflammation. But I can tell you that from my world, somebody has a migraine that goes on for more than 3 days. There's something called status migrainous. What do we treat it with? Steroids. And what do steroids do? They're knocking down inflammation. So it has more to do with inflammation than what we have given it credit for. So let's start looking at the cytokines. Let's start looking at the inflammatory pathways and the inflammatory markers. And Kevin said this before, don't forget, inflammation is actually also a good thing. It helps to protect us from a lot of other things too. So we shouldn't all be on anti-inflammatories on a chronic basis. That's not a good thing. Okay.
Sure. Yeah, I agree. It's how the body heals itself.
That's
it's
right.
Unregulated inflammation that is, tends to be systemic and
when it gets directed against your own body, it's when the inflammation gets directed against your own body, that's when it becomes a problem. It's fine when it's directed against a pathogen, etc., but it's a different story when it starts to become autoimmune. You start to affect your own body.
Exactly.
Mm-hmm.
Yeah, so we were just listing through some of those causes of underlying contributing factors to neuroinflammation, a couple other just general oxidative stress, hormone imbalances, and other environmental toxins. So mold exposure or heavy metal exposure, those are going to have significant neurological implications there. So what do we do? and I think in our world too, like we want to consider neuroinflammation well before it gets into a more advanced stage. We don't want things to advance to Parkinson's and Alzheimer's and dementia, because there's a lot of tools in the toolbox to reverse and prevent those things well before they become too advanced. So biggest things, lifestyle. So sleep is probably the number one thing that your brain needs to restore and function properly. And we're, saying at least 7 to 8 hours. You can't be that person that's burning the candle on both ends, or, oh, I don't require that much sleep. I mean, what's the guy's name that wrote the book?
Matthew Walker.
Yeah, Matthew Walker says that's hogwash. He's never, there's genetically, predisposed people that can maybe function off of 6.5 hours. Like, you have to have very special genes in your life. And I think that's like 1% of the population that has these, that can function off of 6.5 hours of sleep. Everyone else requires at least 7 to 8. So, again, we've talked about this, we've blogged about this, being mindful of screen time and blue light exposure before bed is really important. Keeping electronics and EMF out of the sleeping environment, keeping a temperate, a cool sleeping environment is all going to help promote better sleep. You need to, especially to kind of kickstart a circadian rhythm, to take melatonin or something to help you sleep. It's okay in the short term. But again, prioritizing proper sleep is paramount for optimal brain function and brain health. And then we have exercise. So I would like to say all exercise has great, health promoting properties, and obviously it does. But the most kind of bang for your buck, and the most beneficial for the brain is going to be high intensity interval training, HIIT workouts, kind of having those cycles of high intensity, low intensity. The brain responds really well to that. So if you are, Murphy wants to say hello. No, he's coming over because it's starting to storm. He's a little anxious.
You need some CBD or some magnesium or something.
Yeah, so I mentioned that can be great to help you go to sleep as well. So just I would endeavor, if you want to protect your brain health or feel like you have some neuroinflammation, definitely take part in high intensity interval training. Diet, we talk about diet all the time. Kind of like I mentioned with the aquaporin for autoimmunity. I mean, food proteins really, really impact our bodies, especially our brains. And so, you wouldn't, we don't expect everybody to know if they have aquaporin for autoimmunity and they can't have, corn, spinach, and tomatoes. However, that's when you need to go to, we're encouraging you, if you have neuroinflammation, to, start unpacking these layers so that what diet and lifestyle things you can take off that burden from your body. The two huge food proteins that are going to be inflammatory to the body and especially the brain are going to be gluten and dairy. That's my most general recommendation. If you're not sure, but if you have neuroinflammation, I would say it is just not worth continuing to eat gluten and dairy to progress, into a more advanced stage of neuroinflammation. And hey, taking those out strictly for a week or 2 or 3, you're going to start to feel your physiology and your brain function shift. So then that's a really great way to know.
I wanted to just chime in. Sorry to interrupt. I want to chime in, so there's something called gluten ataxia. And so your cerebellum, the little mini brain sitting at the bottom and back of your head there, you can have, it's called gluten ataxia because gluten can look a lot like the proteins in the cerebellum. And if there's a reactivity there, somebody who's getting dizzy or having balance challenges or other cerebellar mechanism issues and dysfunction, if you're consuming gluten, that should be something that should be considered. Now, it doesn't necessarily relate directly to depression, but when it comes to brain health and brain inflammation, that's a very clear example in the literature of molecular mimicry in the brain as well, beyond aquaporin 4 receptors and some of the other things that have been mentioned. But, you look up in the literature on PubMed, gluten ataxia, cerebellum is getting destroyed because of the consumption and the molecular mimicry that occurs.
Perhaps it's a shameless plug, but the book Restorative Kitchen that I wrote really goes in depth and removes many of the inflammatory food triggers. And so if you're concerned of anxiety, depression, other neuroinflammation, please pick up that book and follow it. Even if it's for a few weeks, you're going to see some really significant changes and really learn a lot about your physiology, your personal physiology there. there's a lot of nutraceuticals that we can use to help with brain health in general. So I'm saying a lot like brain health. I mean, I know we're talking about anxiety and depression, but overall, if we're worried about cognition or memory or, preventing dementia, Alzheimer's, whatever, we can take these things. So glutathione, we talk about glutathione a lot too. Glutathione is the body's master antioxidant, and it's wonderful for the brain. Polyphenols like curcumin and turmeric are also going to be wonderful anti-inflammatory agents for the brain. Now, both of these classes, the glutathione and the polyphenols, are going to help decrease oxidative stress, decrease free radicals. They're going to help kind of boost blood-brain barrier integrity. So again, probably just as important as having an intact gut barrier is having an intact blood-brain barrier. So really important. Those compounds are also going to decrease inflammatory cytokines as well. So glutathione, polyphenols like turmeric and resveratrol, oftentimes they work really lovely in a synergistic way together. So
they complement and amplify what they're doing for each other, especially the resveratrol and turmeric.
Yeah, absolutely. So I would say I'd recommend if it allows to do those hand in hand. Magnesium, we talked a lot about the voltage-gated calcium channels last week with EMF. So magnesium has a great, piece in that story, as well as modulating the M1, M2 pathways, which again are neural pathways that we're not really going to get too much into the weeds about, but that's the mechanism behind why magnesium is certain forms of magnesium are really helpful for brain health. Short-chain fatty acids are really fantastic for gut health and overall inflammation. Even certain prebiotic fibers kind of have a similar interaction there. So again, just helping boost the immune system by having anti-inflammatory and gut supportive properties. And then finally, DHA. So relatively higher doses of DHA have a very protective, just overall neuroprotective qualities. They have a very healing action healing and protective action on the blood-brain barrier and just the neuron membrane. So so that's my list, guys.
The DHA is one of the kinds of fish oils, if you will. It's one of the omega-3 fatty acids.
Yeah, and typically for brain.
You want a higher DHA. A lot of fish oils are very high EPA, which is good too. But when it comes to brain health, DHA is the omega-3 fatty acid that is going to be the most neuroprotective.
So again, that's glutathione, polyphenols like curcumin and turmeric, magnesium,
resveratrol.
It's getting late, guys. Short chain fatty acids and DHA. So consider those. Talk to one of us. Talk to your doctor and see if those would be helpful to supplement with.
And I'll make the last plug, especially when we talk about things that we can provide for the body and things that we can avoid. Let's not forget about alcohol. Okay. Yeah. I know you guys don't, but alcohol, like Dr. Heaven was talking about, has a significant effect on the cerebellum. It also has a significant effect on all levels of the brain and nerve fibers in general. One of the biggest causes of peripheral neuropathy is too much alcohol. The amygdala, the memory cells, you believe it or not, alcohol is a CNS depressant. So as much as you drink alcohol and, oh yeah, it's great, I'm going out there and we're going to get him and get his energy, is actually killing cells as you speak. And so that's why you don't remember things the next day, because you've knocked down cells from the amygdala, etc. Certainly we talked about small amounts can be very cardioprotective, but it's not very good for nerve fibers in general.
Yeah. What questions do you all have on this kind of high-level brain depression story so far, before we, in a few weeks, jump into a little bit deeper neuroinflammatory components that I think are also important to know and understand. What questions do you guys have? We didn't get any in advance, I don't think. So
we did. I just answered it.
no, never mind. I didn't know. I was on a need-to-know basis.
Or they can store them up for next time too, some specifics, etc. That's fine too. Just hopefully just started a stimulation to thought processes and questions as well. And there's going to be some specifics. It's been late. It's a late day. Okay, specifics that might be more done on a one-to-one basis rather than in a chat room or something too.
Yeah,
so
exactly.
Mm-hmm.
Well, if nothing's popping up in the chat bar, we appreciate all of you. Thanks for your time and attention here tonight, and be on the lookout for that in a few weeks. We're going to be talking about that. No problem, actually. And when it comes to our next series as well, you've probably noticed if you get our newsletter, if you check our blog out, there's been a whole bunch of things on EMF that went out. We're going to be doing a whole series on neurotransmitters coming up here. They're all written. We've just got to start publishing them.
There's a lot of good juicy stuff in there.
Yeah, so
transmitters, brain inflammation, a lot of stuff that we've been discussing, serotonin, dopamine.
This is kind of the primer for that next series that's going to be starting to come out in our newsletter and on our blog. So Dr. Ash works quite hard on all of that. So make sure you check those out and feel free to share them. But appreciate all of you and hope you have a great rest of your night.